The mental health of the American Generation Z has been a hot topic research in psychology for the past decade. The National Survey on Drug Use and Health has done a study on over 600,000 Americans and has found a number of trends regarding mental health that will be stated. Major depression among 20 to 21-year-olds has doubled, rising from 7 to 15%. And among 16 to 17-year-olds, the depression rate has surged 69%. Serious psychological distress, which includes feelings of anxiety and hopelessness, jumped 71% among 18 to 25-year-olds from 2008 to 2017. Twice as many 22 to 23-year-olds attempted suicide in 2017 compared to 2008, and 55% more had suicidal thoughts. Tragically, suicide also jumped this period stated among 18 and 19-year-olds, and this climb is also 56%. But how is this happening? It's not a socioeconomic issue. The United States was strongly growing economically, and the unemployment rate dropped significantly from 2008 to 2017. And it's not academic pressure either, as teens have spent less time on homework now than they did in the 90s. One plausible link is screen time. While in 2012 only half of Americans owned smartphones, by 2016, 92% of young adults possessed a smartphone. So how do we fix this? How do we save the mental health of the youth in our society? Well, there are small ways to be acknowledged, like moderating screen time and calling the suicide hotline if you suspect a friend that is in need. But the best way to do this is to improve access to mental health care. There are the trivial ways, of course. Services for common conditions such as depression, anxiety, alcohol, and drug use disorders should be more accessible in schools and workplaces. But access to mental health care goes further than that. It goes as far as to have friends or family to talk to about your issues. It also means that people should be trained on how to spot signs of declining mental health or struggling mental health within another friend or a family member. It wouldn't be unreasonable, in fact, for this to be a required high school elective or seminar. Increasing access to mental health care also includes changing society culture as it is. There shouldn't be a stigma against those who are depressed or unhealthy. Instead of staying away from people who are depressed because you fear it will spread to you, maybe you should help them out of their depression. For anyone watching this video, if you have a disturbed friend, please call the suicide hotline on what to do and definitely reach out to them. Studies show that access to mental health care is really the only proven method in preventing school shootings as we have right now. My final note to the viewer is talking to someone who you think is depressed and helping them get out of the rut can even prevent school shootings, and most importantly of all, supports the mission of improving access to mental health care.